Vanakkam, Namaste and welcome to Dr. Shah's Clinic. In yet another video on erectile dysfunction, we are going to answer the question, what causes sudden erectile dysfunction? So, a man is said to have erectile dysfunction if he is unable to sustain his erection adequately, of sufficient rigidity for an adequate duration of time to allow satisfactory penetrative sexual intercourse. And what's important is the erectile dysfunction should be present in at least more than 50% of attempts on an average of at least in a month. So if in a month the individual has tried 10 times, if the erection does not sustain more than 50% of the time, then the patient is said to have erectile dysfunction. Now, in this video, what we're going to kind of look at is what are the causes of sudden erectile dysfunction. So sometimes patients come to the clinic and come with the complaint, doctor, my erection was good for the last 2 years or 3 years. Suddenly, over the last 2 weeks or 3 weeks, my erection has completely gone. I'm not able to get an erection. It's of inadequate rigidity. I'm not able to penetrate it. I'm not even able to penetrate my partner. So in these instances, what we actually look out for is whether any important life-changing events or life stressors that happened in the preceding 1 month or 2 months during the time the dysfunction developed. Now, the reason I say why specific life events is because erectile dysfunction that's usually sudden in nature, all of a sudden if you notice your erection is completely gone, could be more psychogenic versus organic. So we classify erectile dysfunction into psychogenic ED as well as organic ED. That's the two classification systems. So psychogenic ED can occur to individuals who are usually at a younger age group level. Although at all age groups are susceptible, it's usually seen in the young. So at younger individuals who are usually less than 35 suffer more from psychogenic erectile dysfunction, and psychogenic ED is usually caused by interpersonal conflicts with the partner. So you might have had a major misunderstanding with your intimate partner or your loved one, or you might be going through a phase of stress or anxiety in your life. You might have had a major job change. You're not really happy with your job. Maybe you're working night shifts for a very long time and your sleep work cycles are dysregulated, and that's affecting your overall mood and overall stability. So there are a lot of factors. Psychogenic is basically anything that can actually affect your psyche. It affects your mind more than your body directly. Of course, anything that affects the mind affects the body. That's another story. But all said and psychogenic factors are not something that you can directly pinpoint. So what we have to do is rule out psychogenic causes of erectile dysfunction. So some questions we ask to diagnose why sudden erectile dysfunction developed in a particular individual is point number one: was there a major job change that was very dissatisfactory in nature? Or did the individual lose a job? Was there a death of a loved one in the family? Were there a lot of fights and misunderstanding with the intimate partner? Were the fights actually resolved, or were the fights actually left unresolved? So that's a very important point. So if you are actually fought with your intimate partner, you may notice your erectile function actually going down. That's completely understandable, because every time you look at her, maybe you feel a sense of disgust or a sense of resentment or a sense of remorsefulness. And that has to be resolved in order for you to gain back, a good erection. Apart from that, we also ask about the individual's, sleep-wake cycles. If the individual has a lot of thoughts, go into the mind, because sometimes patients have, minor degrees of obsessive compulsive disorder, OCD, and what happens even during sexual intercourse, they're actually obsessing about something else. That can also actually cause erectile dysfunction. So we check the individual, at a very intricate level, we assess the thought pattern of the individual. Some of the causes, of sudden erectile dysfunction. Of course, we have also seen organic causes, but although it won't be that common in patients who develop sudden ED. So organic causes are basically diabetes, hypertension, cholesterol, male sex hormone imbalances, and those kind of things that actually affects the bodily functions directly. So that should also be ruled out in patients who develop sudden erectile dysfunction. However, the shift in terms of causes, that is the large proportion of cause for sudden ED is usually more psychogenic versus organic. Although organic factors must also be questioned, ruled out, and if needed, tested. So I hope you enjoyed this video on what causes sudden erectile dysfunction. I've made many more videos elaborately on what are the causes of erectile dysfunction and what causes erectile dysfunction in individuals who are less than 30 and more than 40. Please do have a look at all these videos. I have links somewhere on the right and the left hand side of the channel. Please like, comment and subscribe, and share this video with all your friends and loved ones. This is Dr. Shah, and see you soon with another video. Vanakkam.